intelligence, and mercy to start this delegation in health and peace, so that at the end of the day, our deliberations will be fruitful and useful to everybody. Amen.
Amen.
In Jesus' name.
Amen.
Mighty God, I want to pray that at the end of this presentation, the decisions that will arise thereof will be beneficial and will make health delivery system in this country to be better. In Jesus' name.
Amen.
In Jesus' name we pray.
Thank you. So the next item on the agenda is self-introduction. My name is Dr. Michael Chima. I'm head of Regulation and Professional Schools Division in the department. Thank you.
I'm Dr. Fashai, S.S., Head and Director of Health and Telemedicine.
My name is Dr. Pipi, Tertiary Hospitals Division.
I'm Dr. Edna Mochepa, Buses Service Division, FMH.
The word coral generated from what we call the coral reef. It's an aquatic marine life which we have done a lot of researches, and we noticed that it has been a very great approach in medical practice affecting different kind of health conditions. But to understand that word coral, it means to be in a continued, for each letter word, for you not to forget, in a continued, optimal, revitalizing, active lifestyle. We're about 6.2 million members worldwide. And we have the saying, being coral, you start by practicing to stay healthy, because we don't feel happy when we meet patients in hospital. No doctor feels happy. We want to reduce morbidities in Africa, at the same time reduce mortality rates. Because in Europe, the mortality rate is basically 80, 90 years old, but in Africa, as I understand, it's 55, 60. It shouldn't be so. Because God has given us, we Africans, a protective layer, which we call the melanin. Having that protective layer means we should live longer. There's a molecular biology to this. And we have developed, next please, 4 sequential steps, no matter the health concern of people. Remember I said it's a combinative approach called cellular medicine. By the next slide, I will discuss more about the cellular medicine. The 4 sequential steps, we start with super hydration. We don't drop any steps in coral health. After super hydration, we do systems detox. And only after these 2 steps, you can now think about cellular nutrition, what most companies call supplementation. Because if you don't do the 2 steps based on all the researches we've done in Europe, no supplements will ever work. That's why some people keep complaining across the world, oh, we take supplements, but it's not working. You learn the reasons today. And the last step is a kind of preventive healthcare, which we call protection or prevention. These are the sequential steps we follow in coral. And when we start the 4th step, super hydration, immediately we activate the 4th step, the protection. It's a part of medicine called integrated cellular medicine. Next, please. We like to do this sign in Coral Club, in Coral Health. If I'm doing this, it means wishing you a perfect health. And how many fingers is remaining? 4. You achieve it sequentially, 4 steps. That way you remain healthy if you want to, if you're already healthy. If you're having a health challenge, we have a way to revitalize you to come back to your health, in addition to what we do to the patients in the hospital case scenario. And that's why everybody, be you even a day-old child, you can be a Coral Club member. Being a member is just free, just like when you come to hospital, they open a case file. We're all over the world, you can just register online. In Nigeria, a subsidiary of Coral Club International, it's Coral Nigeria. So coralnigeria.com, you have easy access to be a member of Coral Club. Just like having an identification number. Why is this membership important? You can find yourself tomorrow in the US. We have over 402 facilities in the world. The very first facility in Africa is in Imo State, because I'm a Nigerian from Imo State, but we are coming soon, very soon, within less than 3 weeks, to open our facility in Abuja, and then subsequently Lagos. You can find yourself anywhere in the country. In the Coral Club facility, a standard facility has 2 consulting rooms for medical practitioners, and we doctors in Coral Club, we work as volunteers. How do we work as volunteers? Our consultation, we don't take money for consulting people, trying to get their life better. Because when I wrote the letter to the ministry here, I wrote, our advocacy is for lifespan prolongation. And if we have to do that, we have to be committed to give all the knowledge of medicine we have, in addition to the cellular approach. Next, please. Good. Now, to understand Coral Health's concept, this is hospital case scenario. People that come to us in hospital are called patients. Any doctor you are, the way we work in hospital is only organ level. Organ level practice, the orthodox medicine. Now, organ level in the sense that when patients come to us, we take an anamnesis. We try to determine how it started, what we call the subjective examination. The doctor colleagues here will understand that better. After subjective examination, we ask questions, we take down. We want to see what is happening inside the organ. It's called objective examination. In my own case, as an orthopedic surgeon, I look at people that have fractures or inflammatory processes to their joints. Then I send them to objective examination, which is called X-ray. When I'm not satisfied with X-ray, I send them to CT scan or MRI to see the soft tissues. What I'm trying to do at that time is to determine all parameters before I can draw diagnosis. When I draw diagnosis, I start to treatment. Most fractures we do surgical and then followed by conservative. If we see anything only indicative for conservative treatment, taking the drugs, which we prescribe. What are we trying to do as doctors? No matter your specialty, be you pediatrician, gastroenterologist, whatever, it's the same process. Now, we draw diagnosis. We doctors don't really tell people this, but if they will permit me, I'll release the secret. We doctors were most effective in acute cases. We love acute cases. Most chronic cases, we basically manage people on organ level. Hardly. We manage you for a long time, like diabetes mellitus, for instance. We manage you, either we determine the kind of insulin we give you, short-acting, long-acting, or we do conservative, the tablets, glucophilin, that's what's popular in Africa. We do this and you continue to take it, lifetime. That's organ level. Doctors are not God, by the way. We're doing the way we know what we know. But acute cases, we are fast. We have another classification we call the subacute. There's parameters, I don't need to go into the big languages. These 3 classifications, our aim is to restore the function controlling that organ. The function of that organ, controlled by the system. And in our body, we have 12 systems. That's what makes us the human being we are, be you a child, a male or a female. But for us to get a better outcome, remember simple biology. Before these organs were formed, what were they? Tissue. And before they were tissue, they were cells. Coral Club in Europe, we developed cellular approach. Because these cells, that's signified with the green, they live in the liquid environment of the body, which we call the body fluids, physiology. Body fluids, for the adults, we are made up of 70% of body fluid. We remember the body fluids only in one case scenario as doctors. When we send it to the blood test, because the greatest among the body fluids, 80 to 90% is the blood, out of this whole 70 that we have. So a simple question, just like pass mark in the universities, 70% means excellent. If the body is composed of 70%, and the foundation of the body are the cells, because without the cells, the organs will never form. Which part will it take more? Is it the remaining 30 or the 70? Of course, the 70. This is our approach. For chronic cases, when we do anything, sometimes we try to classify, make some classification. When we search, do all the test results, whatever, we cannot draw a diagnosis. We have a way to cover up. We say idiopathic process, unknown. Because we're trying to determine, we cannot determine the problem. So, when chronic cases arise, even normal cases, whatever we do as doctors, we encourage medical practitioners across the globe to combined cellular approach. And what's this? Remember the 4 sequential step. Super hydration. Why? Because the body fluids, there are 5 of them. Next, please. First is the blood that flow in different vessels. That's the greatest among the body fluids. Next is cerebrospinal fluid that lubricates our brain and our spinal cord. Next is the joint fluid. If I'm walking around, it's because my joint fluid is sufficient, unless I'll have stiffness. Joint fluid. Greatest among the joint fluid is the synovium. Next is lymph fluid. We talk about the immune system prevalence or immunoprotectors, whatever. We try to classify the B or T lymphocyte to determine your immune system. Because the lymph fluid is there, because all the cells live in the liquid environment of the body, which is the body fluids. And the last is interstitial, which are between organs. Let's take, for instance, the heart. The heart has 2 double layers and has a pericardium. This is the layer. Inside the pericardium is called the pericardial fluid that lubricates the heart. That's the interstitial fluid. Our diagnosis again. When it's infected, we say pericarditis. Because anything inflammation, either defensive or negative, positive feedback mechanism, we have to restore the health of the people. So we classify itis as inflammation. So forget the big languages in the dictionary about the diagnosis. This is our approach. If you concentrate on all these parameters, you restore health efficiently, as a rule. But remember, the wrong thing companies do, they'll sell only supplements. They try to castigate medical practitioners. No, it's wrong. Supplements will never work if you don't do first and second. And I'll tell you how. Body fluids from baby. This is molecular biology. According to World Health Protocols, we have over 200 parameters of the fluid. But 3 parameters are main. Clarity, first parameter. Charge, and then alkalinity, which a lot of people preach about. But the greatest to keep you healthy is the negatively ionized charge. Because whenever anybody is sick, no matter the health condition, you're positively charged and you're going into an acidotic medium, no matter the health concern, as a rule. For these body fluids, the only food our body asks us of is that water we drink. Water. When we feel thirsty, that's why we have the bottling companies. They've achieved the greatest parameter, which is clarity. Be it pure water or whatever. I bought some on the road just to show you a test. I'm not trying to, whatever you notice what I will do, I'm not trying to blackmail these companies because they've done their job to do clarity. Imagine the people in the villages. They drink from the river. They're not drinking clear water. So clarity achieves to be here again. About the economic value, the price. Coral Club developed a model whereby whenever you have a member number, remember registration is free. You just go to coralnigeria.com, make a registration, select your region of Nigeria. Once you're a member, you have a 7-digit code. Whenever you want to get any of our products, by God's grace, within a short time, we have facility in Abuja, you are entitled to 20% discount. That's the first benefit. We have a central price, pricing in dollars. How did Coral Club help Nigeria? The actual rate outside the market is 360, right? But Coral Club made a flat rate of 300. Because we are, for any of the products, okay, we have over, I'll answer also the regulatory question, we have over 100 and something products, but we've decided to start with the initial 6 with another registration based on the 4 steps. And I'm also responding both questions about the NAFDAC and the cost. SON, we were made to understand once you have NAFDAC, for something you take into you don't need SON. But SON, we're about to implement that we just finished with NCC through our partner, ABG, about the licensing for the neotronics. But we are yet to now start the SON this time and back. But for the NAFDAC, we have the notification already, based about, the certificate don't come out immediately. So, and unfortunately, we are unable to proceed with other subsequent registration we want to do because they were in this Johesu strike. So, but we are trying our best to go one by one because most